Hey everybody, Dr. Jared Skowron here from Spectrum Awakening. Today's Facebook Live is going to be the third step in our new series about helping your child recover from autism. So, as a really exciting part, because we're, to kind of review what we've done so far. And you can, if you're new to Spectrum Awakening, you missed the past couple Facebook Lives. Again, we've been doing Facebook Lives for almost 4 years now, so you can go back and watch any of them. However, this series starts 2 weeks ago, and we're kind of leading you into this new Facebook Live series, kind of walking you through how autism happens and how we can reverse it, and what I do in my clinic with my patients to kind of walk them through this process. So we go back a couple weeks, we started with step one, and step one is, hey, why does my child have autism? And we talked about the differences about being born with a genetic condition that causes autism and causes developmental delays, or for the majority of people, those people that have an obvious regression, usually between 12 and 18 months of age, and that obvious regression is a different cause than the genetic cause. So, there are two different ways that we need to treat. So that was step one. Step two, which we talked about last week, was about balancing brain chemistry, because there are certain chemicals in the brain, and those chemicals will control practically most autism symptoms. And that is language, that is sleep, that is behavior, that is sensory, that is motor. So many neurological symptoms are going to be caused by an imbalance of brain chemistry. And so step two was a set of 4 supplements that we have, which we now are calling the Skowron solution, which is a certain protocol how to use these 4 supplements in certain orders to balance brain chemistry. All right, what's next? Again, because autism is a huge thing to tackle. Step 3 that we're going to be talking about today is diet. All right, now, let me just first say that, dietary interventions have been out and used for a long time with autism, and there are many diets. But the most important thing to remember is, number one, there is no one diet for everyone. Period. Okay? There is no one diet for everyone. Certain people will do better on certain diets. Certain people do better eating certain foods and avoiding other foods. So that is what we need to be looking at when we talk about diet. Now, before we get into the different diets, and again, there's a bunch of different diets, and as I said, they're all different for different people. What is important, or the why we're doing it, like, why am I changing our diet? Because guess what? It's a lot. It's a lot to change a diet. Our kids are picky eaters. So what do I do with my kid who's a picky eater? And it's hard to do these diets, okay? You've got to know the reason why you're doing it, period. You've got to know that reason why. So let's walk through why I would make a dietary change, and maybe how am I going to know which diet is best for my child, okay? So let me kind of show you, I typed up a few things here for us. We're talking about step 3 here, brain inflammation and diet, because, again, we are trying to reduce inflammation, all right? And let me pause. I just showed this, but let me pause. Think about a sprained ankle, okay? When you sprain your ankle, it swells up and you can't even move it one little bit, because if you move it one little bit, all of a sudden it hurts, all right? This is what can be happening in the brain. It can be so inflamed and so swollen that any one little thing is going to cause pain or cause problems. And we need to decrease that inflammation so that it's not causing the problems anymore, all right? So we need to affect brain inflammation with dietary changes. Now, as we talked about, step 1 is deciding, is my child born delayed? And how you know that is you can run a genetic test called a CMA and a WES. Now, that genetic test is available on our website if you want ours. If you want to try to get insurance to pay for it, ask your physicians and say, hey, I want this testing. This is conventional genetic testing. I want to know if my child was born with a genetic condition. Next, did you have the regression? Please, if you had the regression, try our new detox regression homeopathic. It is brand new for us from a couple weeks ago, and we're already hearing good responses. In fact, one of our friends who's always watching here is going to share a wonderful video about her experiences with her son and how his language has increased only using this stuff for a short period of weeks, which is awesome. This is what we're trying to do, okay? Then step 2, we talked about balancing the brain chemistry, and that's our new protocol of 4 supplements, the Skowron solution. All right, so step 3, let's get into inflammation and diet, all right? Certain foods cause inflammation in certain people. Now, those foods are different for everyone. You gotta understand there is no one diet, no one answer. I know that's not an easy answer, but it's a real answer. So we've got to find out how certain foods might be causing inflammation. So let's go through the different ways that can happen. Number one, you may have a food allergy. Now, a food allergy has to do with IgE antibodies in the bloodstream that causes an elevation of histamine. So you have histamine inflammation from an IgE allergy. Now, you can get this testing done. You can get a blood test that looks for your IgE food allergies. You can go to an allergist and get, the 1,000 mosquito bites to test for your food allergies, all right? That will tell you, hey, these are some foods I can avoid because these foods will increase histamine release in my body. Histamine causes inflammation in the brain. Let me say that again because it's the point of our Facebook Live. Histamine causes inflammation in the brain, all right? You got to remember that because that's everything we're talking about right now. So you've got to avoid those foods that you are frankly allergic to. Next, you may have a food sensitivity. Now, food sensitivity is not governed by IgE antibodies, but by IgG antibodies. Those cause a non-histamine inflammation, okay? Now, this is where, more natural medicine breaks from conventional medicine. Conventional medicine doesn't believe that IgG antibodies related to food cause any problems. However, if you're going to get tested to see if you've had any type of infection and therefore an immune response to that infection, you're going to run your IgGs, okay? If you want to know if you had COVID, you'll run COVID IgG antibodies, either to the capsid or to the spike protein, okay? If you want to know if you had an immune response from your COVID vaccination, you test IgG COVID spike protein. You find out if you had an inflammatory response, an immune response to that, okay? So, conventional medicine understands IgG as part of the immune system and causes inflammation. Conventional medicine doesn't associate that food, but we do. We understand better, all right? Next, you may also have a food intolerance, all right? So any kind of a food intolerance is basically an inability to digest the food. So think of a lactose intolerance, okay? You drink milk or yogurt or whatever, and you get a big bloated belly. That'll cause a lot of digestive pain and abdominal bloating. That's a digestive intolerance, okay? So these are the three different ways you can react poorly to a food. You can not be able to digest it. You can cause an immune reaction to it that causes inflammation that's not histamine involved, or you can have a frank allergy that is histamine involved. All three of these cause inflammation in different ways. We've got to avoid the foods that we have allergic responses to, that we have sensitivities to, and that we have intolerances to. Now, luckily, we can treat an intolerance pretty easy with digestive enzymes, which we'll get into, but you've got to look at those things. So what can I do? All right, let's start off with first, allergy testing, IgE. Like I said, you can get the blood draw, or you can get those skin prick mosquito bites with your allergist, all right? If you want food sensitivity testing, this is a little harder to do. You can find IgG antibodies to certain foods. We have a finger stick test on our website, spectrumawakening.com, if you'd like that. You can also do this IgG through a blood test as well. But again, we're looking for antibodies that cause inflammation. Next, intolerance, digestive intolerance, the way you figure that out is basically different trials and errors. You're going to eliminate certain foods, see if you still have that abdominal bloating and pain, or start some digestive enzymes, which we'll get into in a little bit. We'll talk more about these supplements later. But again, these are different ways you can test to find out, hey, how does my child react to a certain food? There is no one perfect test for foods, okay? That's kind of the sad part about our technology right now. However, trial and error is the best. So let's get into some really great research. I printed out a lot of research studies today. I hope you don't get a little overloaded by these. So I'm gonna start with a research study from 8 years ago from my favorite autism gastroenterologist, Dr. Tim Bowie. He's up in Boston. He's amazing in the autism world. I'm sure many of you have heard of him. This is one of his studies. And again, he wrote about the relationship of autism and gluten. Okay, and this was back 8 years ago. So more research has come out. All right. So let's kind of follow everything he talks about. At that time, there was only one double-blind crossover study that showed no benefit of a gluten-free diet, okay? However, he does note that gluten sensitivity can present in a variety of ways, including gastrointestinal and neurological symptoms, okay? This is a Harvard doc saying this. sensitivities, not allergies. A diagnosis of celiac disease is easy to do with blood tests or biopsies or genetic testing. Gluten sensitivity patients do not have celiac disease, but yet still have the problems. Unfortunately, there's no good testing for gluten sensitivity at this time. So I printed his study to show that even 8 years ago, there was not a lot of good research on these diets and autism, but to also understand that one of the best gastro-medical doctors in the business understands there's a difference between celiac disease, gluten allergies, and a gluten sensitivity, okay? And avoiding gluten should be done for any reason, in my opinion, allergy or sensitivity or intolerance, okay? Now let's get into some more closer research, and I'm going to show you some research studies that conflict to kind of show you what people are thinking about out in the medical world, okay? So this is a research study that says the gluten-free, casein-free diet, double-blind challenge with children with autism, that the gluten-free diet or gluten casein-free diet did not have statistically significant effects on kids with autism. However, there were only 14 kids in this study, all right? So it's kind of hard when you've got a double-blind study that you've got 7 on the diet and 7 eating the food. How accurate are you going to be with 7 kids when all of these diets are not the same for everybody? Okay, so you've got to look at these research studies and understand how efficacious, how accurate is this study, and the number one thing to look at is how many people are enrolled. All right, here's another one. Gluten-free, casein-free diet disorders. This was an interesting study, and I pulled this because what they told people is there's little evidence that a gluten-free, casein-free diet is beneficial. However, you start reading more and it says, well, one trial found that there were significant improvements in communication skills as well as social interactions. Another study found significant differences in communications and social contacts and general autistic traits. So you may get a research study where the authors say, you know what, there's really no evidence, but yet they do acknowledge that there's evidence. And so that gets confusing when the kind of the general message that they want to present is this doesn't work, but in their analysis, they do mention that it can work. So again, not one size fits all. That's why this research is hard with diets. Next, we've got a gluten-free diet in children with autism. This was a bigger study. We got 66 kids. That's pretty good. However, this showed no differences between groups in autism. And this came out just last year in 2020, kind of before the whole lockdown thing. And there was some talk about this study, especially in those groups that say, hey, diet doesn't work. Don't do any diet stuff. I don't know why they sound like they smoke 12 cigars a day. But that study was done in Poland. And in the European Union, there is much cleaner food than here in the US. So again, this is where this dietary stuff may be different if you're in Europe versus in the States, because in Europe, there's no glyphosate. Okay, there's no genetically modified gluten. So you're looking at apples versus oranges. You're looking at genetically modified gluten here in the States with glyphosate, which is a pesticide. And then you go to Europe and you've got non-genetically modified gluten without pesticides in it. So it's a different thing we're looking at as apples to oranges. So I don't want to, if I was in Europe, I would say, okay, maybe gluten-free is not as efficacious for kids because it's a different gluten than we have here in the States, which is much more toxic. All right, next. Here's a good study. Modified ketogenic gluten-free diet improves behavior in children with autism. So this diet showed, hey, yeah, this is good. And this was done in 2018. Here's another one from 2016 talking about the effect of gluten-free diets on GI and behavioral disease for children with autism. And this was 80 kids, so it was a decent size. 54% had gastrointestinal problems. Prevalence of gastrointestinal symptoms decreased significantly on the gluten-free diet, and also a significant decrease in behavioral disorders on the gluten-free diet. All right, so those are some research studies on the gluten-free diet. For some reason, I didn't print out any research studies on the dairy-free diet, but again, the results are very similar, where you have some tests and some research studies saying, hey, this is beneficial, and other ones saying it's not beneficial. And the way that I get through all that is to basically say no one diet is for everybody. You've got to either do the testing, IgE, IgG, and a little trial and error elimination. Okay, give it like a week or two, see how your kid does. But if you're going to do this trial and error elimination trial, you got to be 100%. You cannot be 90%. It has to be 100%. Let me give you a story. Years ago, one of my first patients, actually it was probably 5 years in practice. Anyway, he was 3 years old, he was nonverbal, and we decided to go gluten-free. Okay, we did the testing, he came IgG positive to gluten. We did a gluten-free diet. And we took him off of gluten. 1 month later, he started talking. He was nonverbal, he started talking. Awesome. Later, he was with Grandma and Grandpa. Grandma and Grandpa brought him to McDonald's. Now, Grandma and Grandpa were good. They were like, hey, what's gluten-free here at McDonald's? French fries. Potatoes don't have gluten, do they? No. All right, great. So, boom, we've got, got the French fries. Unfortunately, certain fast food restaurants have gluten in their coating and flavors of the French fries or of other foods. And so he lost his language that day, and it took a whole nother month to get his language back by going gluten-free. So you've got to be 100%. That's the lesson of that story. So go get that IgE testing done. Get the IgG testing done. Do a trial and error elimination and see what happens. Now, talking about the intolerances specifically, one great way to treat an intolerance is with digestive enzymes, okay? If you're lactose intolerant, you can get a lactase enzyme. Here in the States, it's brand named as Lactaid, but you can use any lactase enzyme to treat lactose intolerance, all right? Easy peasy, lemon squeeze, you can have your cake and eat it too, all right? There is also digestive enzymes for gluten. So you can take a digestive enzyme if you have a gluten digestive intolerance. I would not suggest eating gluten if you have an allergy or a sensitivity, but if you have an intolerance, you can take an enzyme specifically for that. You can also take general digestive enzymes for those who have a lot of abdominal bloating. Most of the time, if your kid has a big belly, not a big belly like mine, but one full of gas instead of filled with, like pizza and beer, that digestive enzymes will really reduce that abdominal bloating, okay? So here's some research studies, or here's one research study on digestive enzymes, which I think are great. This is a randomized placebo-controlled trial of digestive enzymes in children with autism. This had a decent number of kids, 101 kids. The autism group received digestive enzyme therapy for 3 months, had significant improvement in emotional response, general impression, autistic score, general behavior, and gastrointestinal symptoms. How easy is it to just give a digestive enzyme with meals? How safe is it? It's hugely safe. There's very low risk for digestive enzymes. You can help your child with their digestion and, again, all this other things. So I think it's good to go down the road of avoiding food allergies, avoiding food sensitivities, and either avoiding food intolerances or giving digestive enzymes for food intolerances. Now, we've got 2 digestive enzymes here at Spectrum Awakening. Oh, why do I put it so far on my desk? This is our chewable digestive enzyme, okay? This is a chewable enzyme that tastes like papaya. Some kids like it, and it's pretty easy to chew. We also have a specific gluten digestive enzyme. So if you're eating gluten, but you have an intolerance, you can take this with it, and your symptoms may reduce. And again, if you have a gluten allergy, if you have celiac, if you got a gluten sensitivity, I would just avoid gluten. I wouldn't take this with it. But again, we might have a crutch for some people. All right, I'll give you an example. I was working with a 16-year-old in high school who was not autistic, and she was a cross-country runner, and she had knee arthritis. Her knees really hurt her, especially after she ate gluten. Okay, she didn't put 2 and 2 together. We did the test. Turned out she had a gluten reaction. We gave her the gluten enzyme, and all of a sudden, within a week, her knees didn't hurt. She was back up and running cross country again. Okay, how did that happen? Gluten, immune reaction, inflammation, pain in the knees. Can't use the knees. Take the enzyme. Inflammation improved. Immune reaction improved. Symptoms improved. Okay. So that's one thing to do. Now, let's go back to the food allergies, because I think food allergies or a histamine intolerance is a huge issue for so many of our kids, all right? And that means one of 2 things. Number 1, you must avoid any food allergies because that will increase histamine levels in the body. Also, some people just cannot handle histamine. And there are histamines in certain foods, especially foods like vinegar or cold cuts or hot dogs, olives, pickles, ketchup, okay? The histamine in foods can also increase histamine levels in the body and cause more of these inflammation problems. Now, I got a lot of research on this, which I want to dive into, but the end message of it is that histamine causes hyperactivity in the brain, okay? Histamine causes hyperactivity in the brain. Here we go. Let's talk about this. Here's a research study that says histamine regulation in microglia, part of the brain, causes central nervous system inflammation. So setting the state for a pathogenically dysregulated neuroimmune response, we know histamine causes a lot of inflammation. All right, well, what else does it do? Well, here's an animal study talking about how histamine receptors trigger stereotypies or stimming in mouse model of tic disorders. So if you have a kid who stims, if you have a kid who has a motor tic, we're not talking about the bug tics, it could be because of excess histamine causing that problem. All right, now why does this all happen? Well, this normally happens because of altered expression of histamine genes. All right, so here I've highlighted the genes, HNMT, HRH1, 2, 3, and 4. These are genes that affect how our body uses histamine. And if these genes are genetically off or not functioning, you're going to increase your risk for hyperactivity and mood issues and sleep issues when you have histamine in the blood. And let me explain how that works. You know, let's say I'm allergic to something, okay? My daughter bought some mums for my wife yesterday and she started sneezing. Why? Because the mum pollen got into her nose, her body has an IgE reaction to it, releases histamine, activates the H1 receptors, she started sneezing. Could have watery eyes, could have had a runny nose, could have had a rash, all different histamine symptoms from allergies. Histamine also goes to the stomach and causes acid reflux. How many of your kids had huge colic problems when they were young? Could be from histamine, okay? There's also another receptor in the brain called H3 receptors, okay? If I could change the video, I know this is live, but if I could like ping, I would ping out image of H3. H3 receptors are in the brain. Histamine causes hyperactivity, sleep problems, anxiety in the brain with histamine. How many of your kids have worse sleep or worse moods during spring or fall pollen season? Okay, so these genes are where it comes from, and you also start to notice a family history of anxiety or depression or other psychiatric conditions that are actually related to these, because the histamine is not just related to autism, it's also related to a number of psychiatric disorders. So what can we do? We need to reduce the histamine. We can do that with natural supplements, which we'll talk about, but we can also do that with different pharmaceuticals. Obviously, here at Spectrum Awakening, we love the natural things first, but again, you may be able to work with your physicians and get pharmaceuticals. So this is a research study, and these are animal studies, but a blockade of the histamine receptors, H3 receptors, alleviate autistic-like behaviors. Pretty cool. Here's another one doing the same thing. An animal study, histamine 3 receptor antagonists alleviate autistic-like behaviors. Here's another one. Okay. H3 receptor antagonist ameliorates stimming repetitive behaviors and ameliorates neuroinflammation. So we're reducing inflammation by not allowing histamine to hit the brain. All right. Oh, is that enough? Well, I got more. All right, here we go. Here's a role of neuroinflammation in autism that specifically talks about the histamine receptors and using their antagonists as potential clinical use in autism. All right, and again, the research studies just go on and on. We've got to stop histamine from hitting the brain, and that's done through this H3 receptor. All right, so what can we do about it naturally? One of the easiest things to do is vitamin C. All right, so we've got here, this is a research study. I couldn't find research studies associating vitamin C with autism, but associating vitamin C with histamine. So we'll use a little transitive process here. If vitamin C helps histamine and lowering histamine helps autism, can vitamin C help autism? The answer is yes. Again, something very simple and basic is really going to help you. So here's a research study on the impact of vitamin C on histamine levels in seasickness, because we know that seasickness has to do with an elevation of histamine. So using oral vitamin C reduces seasickness by reducing the histamine. These are two really cool ones, all right? So buckle up. This one, vitamin C depletion. And this is from 96, people, all right? We're going back 25 years. Vitamin C depletion is associated with alterations in histamine and alterations in carnitine. How much more autism can we get than lowering histamine levels and having an association with carnitine levels, all right? This one blew my mind. I don't know how this one got published, okay, in today's day and age. Elevated blood histamine caused by vaccinations. I'm just gonna stop the presses right there, okay? Elevated blood histamine caused by vaccinations and vitamin C deficiency may mimic shaken baby syndrome. Shaken baby syndrome is basically a child that doesn't seem to have developed, all right? So when we think about all the symptoms of shaken baby syndrome and all the symptoms of autism, how much overlap do we have there? Is it simply caused by histamine, which can be improved by vitamin C? Intriguing stuff. A few more. Vitamin C, this is a research study associating vitamin C, glutathione, and histamine in other medical issues, not with autism. But again, how often are we worried about glutathione? Okay, we're worried about histamine now. This study was published in, is that 85? That's 1985, people. How long have we known this stuff? We've got to put the pieces together. Here's another one from, again, 25 years ago, just the antihistamine action of ascorbic acid. Ascorbic acid is vitamin C. So vitamin C is such an easy way to help reduce histamine. And Annie just put up a question here, which is a good question. Is there a relationship between oxalates and vitamin C? There are. Ascorbic acid does have oxalates. So those of you who do better with low oxalates, vitamin C is not going to be the way to reduce it. So what do you do instead? Excuse me. Number one, I want you to go on a low histamine diet. So you can just Google it, low histamine diet. Avoid the foods that you're allergic to, all right? There are histamine digestive enzymes out there that will help reduce histamine levels. Excuse me, again, we don't have a histamine digestive enzyme on Spectrum Awakening yet, but you can get it over the counter. All right, the other thing to do, we got to reduce this inflammation, all right? And we're reducing the inflammation by reducing histamine loads, by improving our diet that's causing inflammation. We can also give anti-inflammatories. Now, there's a few anti-inflammatories out there. Tylenol? No. Okay, we're a zero Tylenol family here. All right, everybody, throw it away. Ibuprofen, great. Okay, ibuprofen's a good alternative, but you can't use it long term because it'll give you an ulcer. So what do we do instead? I'm a huge fan of this mega word called palmital ethanolamide. Palmital ethanolamide is a natural brain anti-inflammatory. We've got it in our Panda Bear supplement. I did bring it. Our Panda Bear supplement is our natural anti-inflammatory for the brain. And the active ingredient is this palmital ethanolamide, all right? This research study shows it's a great adjunctive therapy for autism in this randomized controlled trial. This is a case study, 2 cases of how palmital ethanolamide improved language, cognition, and behaviors in 2 kids with autism. Last but not least, I know I got a lot of research studies today. Palmital ethanolamide and its biobehavioral correlates with autism, and again, just more and more research on how reducing inflammation in a varied amount of ways, including palmital ethanolamide, can improve autism symptoms. Sarah just asked a question, what does Panda Bear taste like? Good news, Panda Bear is one of our tasteless powders. Tasteless. Mix it in food though. It does not dissolve in water. It's a fat-soluble supplement, so you gotta mix it in food, but tasteless, which is nice. Okay, so there's a lot to review here. So let me kind of step back and review it. Inflammation causes the brain not to work, period, okay? So we've got to reduce this inflammation. What is contributing to the inflammation besides the original cause of regression, which, hold on, let me go back. I gotta frame this one in my office, okay? Is, for those of you who saw a regression, okay, and I know we are associating regression at the time of vaccination and Tylenol, all right? But does an elevated blood histamine and a vitamin C deficiency contribute to this regression? It might, all right? So what we've got to do is reduce the inflammation. How do we do that? First with diet. This is why diets work, because you need to remove the food that causes inflammation. What food is that? It's different for everybody. Get your IgE or allergy tests. Avoid foods you're allergic to. Get a sensitivity test. It's not 100% accurate, but it's the best thing we got, all right? Avoid foods you're sensitive to. Avoid foods that you have an intolerance and a digestive problem to. Add your digestive enzymes, okay? If you want ours, this is a chewable one that tastes like papaya. This is one that tastes like gluten. Where did I put, sorry, I'm looking for the coupon, paper of the week. Where the hell did I put that? I got nothing. Anyway, reduce those foods. Avoid those foods because they cause more inflammation, they cause more problems. You may have histamine problems as well. Highly recommend vitamin C, histamine digestive enzyme, a low histamine diet, and potentially working with your physicians to get one of these pharmaceuticals that are called H3 antagonists, okay? So something that really can help a lot of kids and move forward. We are in development of a natural herbal H3 antagonist supplement. Won't have that till like 2022, but it's in the works, and at least we know about the physiology of the process. So, deep breath for all that. You got to change your diet. You got to change the diet to make sure your kids are eating the foods that they do well with and not eating the foods that cause inflammation and more problems, period. Okay, and there is no one diet for